For this debate, our topic was healthcare entitlements. Our question was, should Americans be entitled to healthcare? A lot of people don't know what healthcare entitlements are. They are a healthcare program to which certain people are entitled. There are many different entitlement programs in the U.S. One is Medicare, which provides healthcare for elderly Americans. Medicaid provides healthcare to low-income Americans, and an example of a Medicaid program is the Children's Health Insurance Program. Another is Social Security, which provides retirement and disability benefits, and unemployment is another entitlement program. This video explains Medicaid and Medicare. For this debate, we support the notion that healthcare entitlements such as Medicaid and Medicare should be further expanded to cover those living just above the poverty line, as suggested by Senator Hillary Clinton and other Democrats. How are these programs funded? They're funded by the federal government. Medicare is a social insurance program, jointly funded by state and federal governments. Medicaid means tested insurance coverage program. They're funded by federal payroll taxes and general tax revenues. According to the U.S. Census Bureau, 29 million people in the U.S. do not have health insurance, which is lower than the rate in 2014. This may be a result of provisions of the Patient Protection and Affordable Care Act going into effect. Private coverage accounted for 67.2%, Medicaid covered 19.6%, and Medicare covered 16.3%. Medicare and Medicaid currently provide health coverage to approximately 111 million people, which is 1 in 3 Americans. The United States, Greece, and Poland are the only members of the Organization for Economic Cooperation and Development without universal health coverage. This is a system where the government pays for basic healthcare services for everyone. The International Covenant on Economic, Social, and Cultural Rights, signed in 1977, stated healthcare is the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. This expansion could lower the overall healthcare spending. According to a 2013 study, the single-payer system could lower total public and private healthcare spending by $592 billion and up to $1.8 million over the next 10 years by lowering administrative and prescription drug costs. Medicare spending is projected to grow more slowly than private health insurance on a per capita basis. This is 3.4% from 2013 to 2023 versus 4.8% for private insurance. Access to preventative health services could lower the overall cost of services due to foreseen health problems. Expansion could also save lives. Medicare covers inpatient hospital stays, physician, outpatient, and preventative services, post-acute care, and outpatient prescription drugs. It does not cover dental care, hearing aids, long-term services, and supports. The 2009 study showed a lack of healthcare access attributed to 44,789 deaths per year. The U.S. has an average life expectancy of 78.7 years. Early disability, chronic conditions, and preventable mortality is directly linked to lack of coverage that may lower life expectancy. Expansion could make medical services affordable to everyone. This could decrease out-of-pocket healthcare expenses per household, could create more affordable healthcare among all classes. The expansion will allow government to pay all healthcare bills, control distribution of healthcare services, determine availability of services, determine cost of services, and control distribution, budgeting, price setting. Expansion could increase economic productivity. People living healthier lives will miss work less often. This helps contribute to the workforce and tax revenue. According to an Institute of Medicine report, the U.S. economy loses $65 to $130 billion annually as a result of diminished worker productivity due to poor health and premature deaths among the uninsured. Healthy people means happy people means happy workers, and happy workers means a happy economy. This expansion could improve public health, could decrease the degree of morbidity early on to ease the burden of healthcare costs. Preventative healthcare access will prevent the transfer of infectious diseases and potential epidemics, could prolong life and promote health. Healthcare preserves for people the ability to participate in the political, social, and economic life of society. It sustains them as fully participating citizens. This expansion could also benefit private businesses. Financial incentives from the government could motivate private companies to participate, could encourage consumer choice by creating more options, could increase the need for supplemental insurance to fill gaps that Medicare and Medicaid do not cover, and businesses would no longer have to pay for employee health insurance policies. This expansion could stop medical bankruptcies. Healthcare entitlement programs account for 43% of hospital revenue. Medicaid revenues account for 35% of safety net hospital revenues and 40% of health center revenues. Medicare's share of spending includes physician services, clinical services, and spending on hospitals, and Medicare provides additional support to clinicians and institutions. So how can we sustain healthcare entitlement costs in the U.S. after the expansion? We can ration the amount of healthcare utilization. We could instill eligibility requirements more strictly. We could increase individual responsibility with respect to personal health. We could decrease the sense of entitlement. We could diminish expectations about what healthcare services are available and follow in the footsteps of countries with universal health coverage. United Nations adopted the Universal Declaration of Human Rights in 1948, which states, "Everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care and necessary social services." The World Health Organization declares, "Enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition to be universal." Healthcare entitlements in the U.S. A successful expansion of healthcare entitlements such as Medicaid and Medicare to cover those living just above the poverty line will lower costs of healthcare spending, save lives of citizens, make medical services affordable to everyone, increase economic productivity, improve public health, benefit private businesses, and stop medical bankruptcies.